minute or two. We're waiting on some screen sharing. I'd like to welcome everyone to the MedSaver Direct Business Overview. My name's Paul Schneider. I'm going to take the next few minutes to tell you what MedSaver Direct is all about because we're excited about what's going on here. We've recently launched the business, and a lot of people need information about what we're doing. At MedSaver Direct, we have a way to save 90% of Americans money and make money. Okay, we save you up to 90% on a nationwide group of 65,000 pharmacies plus all major chains. So we save you money on prescription medications. And we have all the mom and pop stores, all the major chains, and the grocery stores that have pharmacies in those as well. In addition, we have big contracts with providers like telemedicine providers, so you and your entire family can call 24 hours a day, get your medical needs handled over the phone or over the internet. In 45 states, you can look face-to-face at a doctor and get prescriptions done without leaving your home. This is a big deal. Normally, this costs $40 to $50 per call. With MedSaver Direct, there's no cost. You and your entire family can call in as often as you like, and it takes about 14 minutes to have a doctor reconnect with you. That's the average time. We also have call a lawyer services. So if you need legal advice, say someone rear-ends your car, or you have a problem with an agreement or a house or real estate thing, whatever it is in your life that's going on where you might need the advice of a lawyer to get on the right track, those are unlimited calls as well. And once again, that's you and your entire family can use that service. You also save a bundle of money on dental, nationwide dental services. You save a bundle of money on vision services like Sears Optical and Target and Walmart and Pearl Vision Centers and Crown. There's all kinds. I mean, I can't even list them. Medical diagnostic services, MRIs and X-rays and blood tests and all those things that are necessary now when you're seen by a doctor. Those are all part of what we have here. And then there's lifestyle things like travel and all-inclusive vacations, all part of this plan, and you get unlimited use of all of them, by the way. Okay? You can help others save and create a professional level residual income. That's what this is all about at MedSaverDirect.com. I'm just going to give you some data. Our discount providers that we put together have been around as long as 25 years. They do $1 billion a year in annual sales. The pharmaceutical side does $500 million, which is half of that. So these aren't outfits that just started up yesterday. They provide the service in a good way. They provide these services to Fortune 500 companies. For instance, our prescription drug benefits are provided to Fortune 500 companies, to labor unions, to government and state institutions. They're the pharmacy benefit company. So it's not just some kind of discount program. It's the real deal. The telemedicine side's pretty neat. It's been featured in the last 6 months on ABC News, Fox News, CBS News, NBC News. It says, telemedicine's going to, CBS, telemedicine's going to be part of the future of healthcare. It's just encouraging physicians to look at how we get into this emerging service. Doctors see you, in Fox, doctors see you now, wherever you are. The technology is easy enough for anyone to have a face-to-face conference with a doctor, no matter what time of day. ABC News up here at the top says save money. It talks about the $40 to $50 on ABC News that people pay. Guess what? With MedSaver Direct, you get unlimited use at no $40 or $50. It's zero to you when you call, and you can call all you want. Okay, and it says they can even write prescriptions at the ABC News thing here. What's happening with prescriptions? Since that's a big part of the healthcare play, we got to cover it. Did you know Americans are now spending 97% more on their medications than they were 10 years ago? So that's almost doubled in 10 years. Back in 2010, 48 million people couldn't afford to fill their prescriptions. They were making choices between food and medicine, and Consumer Reports obviously reported that. That's where we got that quote from. So this is a huge deal, a doubling in prices in just 10 years, and this is going to continue. This is exploding. Look at this, what's going on. 75% of all U.S. citizens have taken prescription med. in the last 6 months. 52% of all U.S. citizens take 2 or more medications. What we do is we buy at 16.5% below wholesale. So if a buyer at Walgreens goes and purchases, I'm talking buyer at corporate, purchases something for $1, we're actually paying 16.5% less than that. And that's what you buy it for from us. We pay Walgreens and the pharmaceutical company a transaction fee. So they make money, just a whole lot less. There's not this huge markup. With the Affordable Care Act and all the other insurance providers, by the way, the Affordable Care Act, better known as Obamacare, there are very high deductibles, up to $6,300 and more. We got prescriptions and doctor office visits, add up fast, x-rays, MRIs, diabetic supplies, vision care, dental, common diagnostic procedures. Millions of people need more and better coverage because more and more of this is coming out of your pockets. You don't get any coverage until you've spent $6,300, and that's the average right now. It's gone up so high, it's just out of sight. So we can save you up to 90% on your prescription meds, and we can save you a fortune on all these other things. Okay, so it's a big deal. Also, if you went in to see a doctor at their office, you're going to pay an office visit fee, and then you're going to pay for the prescription, maybe a copay. My wife has a $25 copay with Aetna Health Insurance. She's been on the same drug for 18 years now. Now with our MedSaver card, we only pay $7. So when we joined MedSaver, it put money in our pockets. It didn't take it out. So this is the way it is. And you know what's the best thing about the business of being involved with MedSaver Direct? If you decide you can be a customer, or you can become a customer and a consultant if you want. It's so low cost to start a business and provide these savings to other people that there's no pushback. Everyone can join. That's a unique thing. A lot of businesses cost hundreds of dollars to join, and people can't afford it, or thousands of dollars to join, and they say, gosh, I can't do it because I know it's a good business or whatever, but I just can't do it because of the money. So that being gone is a big hurdle. There's an explosive and lucrative compensation plan that provides potential to earn really a large professional level income the first year in this business. We provide you the opportunity to subscribe to a corporate formulary, plus nationwide dental, vision, board-certified doctors. We've got the call a lawyer service. We've got all the other ancillary services like MRIs and CAT scans and x-rays, and gosh, it goes on and on and on, plus all the lifestyle stuff. So this isn't just another discount program. But we'll stick to the pharmaceuticals because everyone understands prescriptions, because 75% of Americans have taken one. So here you say, well, how good a deal is this? You go to Walmart. For the 7 most prescribed medications in the USA, if you bought them at Walmart's prices, and by the way, a lot of these are on their $4 plan, where it's $4 for a whole month's supply. You would spend, for a 12-month supply of these 7 medications at Walmart, you would spend $1,731. With our plan, you would spend $472. That's a 72% savings annually. Well, guess what? The neat thing about MedSaver Direct is we have a contract with Walmart and Target and Costco and Sam's and all the major grocery store chains and Walgreens and CVS, Rite Aid, Mayors. Guess what? You go to the same store. You could go to the same Walmart and spend $472 where before you would have spent $1,731. So this makes a big difference. By the way, all your pets are covered free. I have a little fox terrier that has to take blood pressure medication now. His prescription was costing $29 at Walmart. Well, now with my new MedSaver card, it's $4. That's a huge savings. It was $29. Now it's $4.10. Huge savings. It obviously pays for itself. Here's a prescription card. People say, oh, these benefit cards, it's just another discount. No, we have a true corporate formulary. This is one of the largest ones out there, DBS Discount RX card. They have 1.4 million subscribers, and we save anywhere from 65%, 56% to 91% over the most commonly used drugs in America. So no comparison whatsoever in terms of price. Which plan is right for you? Well, we've got the standard plan, which is just $7.95 a month, no contract. You can add family members for $4.50 each, your spouse or kids, whatever. You can save hundreds of dollars, maybe even thousands. We have customers that are saving over $500 a month. And one lady contacted our chairman and CEO, Larry Lalamadeer. She's saving $752 a month. That's the standard plan. Then there's a premium plan for $19.95 a month. It includes all the stuff in the standard plan, but it has in addition 30 vacation and travel packages. There are companies marketing the same vacation and travel package, and they charge over $100 a month to get those 30 vacation and travel packages. There's all-inclusive vacations. There's discounts at the pharmacy, over-the-counter discounts for like cough syrup and all those kind of things you buy there. But there's also $1,000 in grocery coupons. We all take groceries. We're going to buy groceries. Maybe we're not going on vacation, but guess what? You're going to buy food. So you got a lot of things that people can use every day. Plus, it's nice to be able to take a vacation that's all paid for. There's 80% discounts on over 400,000 different resorts worldwide, 100,000 just here in the United States. So lots of places to go and have fun or save money, restaurant discounts at 10,000 different restaurants. The best plan we have is the Advantage plan, and it's the one everyone chooses for the most part right now, simply because it has all the features of the standard plan. It has all the features of the premium plan with the 30 vacations and all the discounts and travel and all that stuff. But it also has unlimited call-a-doc services, or telemedicine as it's better known. The industry term is telemedicine, so let's call it that. Normally $40 to $50 per call. It's unlimited, zero costs, okay? And that's for you and your entire family, okay? And unlimited calls to lawyers, unlimited dental and vision and diagnostic testing. If you went frequently to the dentist, maybe some of these plans only allow you so much, and then you're cut off, and then you pay full boat. With this, you get your discounts every time you go. Same with the vision, same with the diagnostic tests. And at all the best locations, all the biggest chains. This isn't some little deal that there's one in downtown New York City and no other locations elsewhere. We're talking nationwide, every city. There's so much more. There's 50 other discounts associated with that. And once again, the best part is you can build a professional level income working part-time, showing people how to save. Okay? The premium plan, the one for $19.95, I'll just kind of hit it again. 3 to 7 day getaway vacations. Free airfare for two, with the purchase of a discounted hotel room, car rental discounts, $1,000 in groceries, $500 in pharmacy discounts. You see all these discounts? You can use as many of them as you want as well. It's not just limited to one use, okay? Movie ticket discounts, $1,000 in automotive care, restaurant discounts at over 10,000 restaurants, golf discounts, hotel discounts. I mean, this resort and condo discount thing is really big, okay? Make sure you check that out when you go to MedSaverDirect.com. I'm going to talk about the compensation plan because people say, okay, you've got a product that's very well timed, obviously with the Affordable Care Act and then all the insurance companies following suit and basically